All right, it is noon by my clock, so we are going to go ahead and get started. Thank you for joining us today for this collaborative webinar with Alliance for a Healthier Generation and Catch Global Foundation on evidence-based youth vaping prevention program and tobacco-free district model policy. My name is Brooks Ballard, and I'm the Vice President of Operations at Catch, and I'll be your moderator for today's webinar. Our program will be approximately 1 hour long, including 10 to 15 minutes for Q&A following the presentations. We have over 1,000 people registered for this event, so please note that if we don't get to your question, we will include contact information on our closing slide, and we encourage you to follow up directly with either of Alliance or Catch's teams. We're excited to kick things off, but as usual, before we begin, I'd like to cover a little bit of housekeeping. First, this event is being recorded. The webinar recording and a PDF of the slides will be accessible on the catch.org website in our webinar archives later this week. All registrants will receive the direct link to that posting via email as well. Second, if you have any technical difficulties today, you can message the host, Catch Global Foundation, and my colleague Sarah will help you troubleshoot. Finally, this is a live event, so we encourage you to ask questions via the Q&A feature in your toolbar. You can send those in throughout the program, and we'll get to them during the Q&A at the end of the presentations. With all that housekeeping out of the way, I'd like to hand things over to Duncan Van Dusen, who is the CEO and founder of Catch Global Foundation, and also the author of the Amazon bestseller, When Are We Going to Teach Health? Duncan, the floor is yours.
All right. Thank you, Brooks. Thank you, everybody, for being here. I'm really excited to hear from our presenter, so I'm not going to spend a lot of time introducing the topic. But what I do want to say is this is extremely timely, the topic of vaping prevention. You know, it's a subset of big issues, mental well-being for students and culture and climate for schools. And I know it's a timely topic because there's 1,300 of you who have registered to be here today. So I think it's pretty obvious that vaping is an issue that is high on the minds of educators, and it's also high on the minds of parents. What's not so obvious is that it's high on the mind of students. And one of the things that has amazed me the most about our work with Catch My Breath is the extent to which students are engaging with the topic, wanting to help themselves stay away from the dangers of vaping and nicotine, and wanting to help their peers stay away from it. And that type of youth empowerment and youth involvement, peer-to-peer teaching, is really at the core of what we do. And I think you'll see, you know, in the images that you see today and in the words that you hear today, you know, the extent to which we're really collaborating with youth to engage in this problem. And we have a youth board of advisors, and we just had a new call for members, and we had 70 youth in secondary school, mostly high school, but some in middle school that applied, which is pretty astounding. So I'm incredibly proud of the work that we've done with Catch My Breath. I'm incredibly proud of the collaboration that we've had with Alliance for a Healthier Generation and all the great work and resources that they brought to the table too. So you're in for a treat today. So let me just quickly introduce our two presenters. First, you're going to hear from Marcella Bianco, who is the Director of Government Partnerships here at Catch Global Foundation. She has over 20 years of tobacco prevention and control experience and works with local, state, and national partners from across the country to provide evidence-based vaping prevention and change policy around social norms around tobacco. And then you're going to hear from Ryan Monroe, who is a program manager at the Alliance for a Healthier Generation. In his role, Ryan works with schools and districts nationwide to implement tobacco and vaping prevention programs to help build a healthier school environment. So let's give our presenters a warm welcome, and I'll pass it to you, Marcella.
Great. Thank you so much. Glad everyone is here this morning. And we're just going to go ahead and get started just to respect everyone's time. So let's get started with, there's some of our youth that we have been working with from across the country. And we're going to talk a little bit about Catch My Breath. But first, let's take a look at who are we as with Catch. So Catch stands for the Coordinated Approach to Child Health, and Catch was created in the 1980s. Its evidence-based school health programs address that whole child wellness, and Catch Global Foundation launches kids towards healthier lifestyles by linking underserved schools and communities to the resources needed to create and sustain healthy change for future generations. So how do we do this? We do this by providing low cost or no cost evidence-based curricula, including PE, nutrition, social emotional learning, sun safety, oral health, and then of course our youth vaping prevention program. And we also empower school communities to cultivate whole child wellness as a lever for student success and social equity. So first, let's take a look at the youth vaping epidemic, why we're all here today, and what can we do to help our young people. So some of the recent data from the National Youth Tobacco Survey, which is administered by the Center for Disease Control, CDC, every year. It surveys about 20,000 students in grades 6 through 12 in regards to their relationship with tobacco products, not only e-cigarettes, but combustible tobacco, spit tobacco. According to the survey data, we still have 2.8 million middle and high school students currently using a tobacco product. Last year it was noted that over 3 million, so we've seen a slight decrease, but in actuality, what is the most common youth tobacco product that students are using? It's that e-cigarette. And that's why we're all here today, to really talk about what can we do within our communities and within our schools, our resources to help our young people. So it's important that we continue to educate our youth on those dangers of e-cigarettes, but e-cigarette companies continue to create accessories that hide devices and really make it look like everyday school supplies or everyday materials that you might not even think about, thus really teaching our youth to be dishonest with us. So let's take a look at some of those accessories. So this was a new one that just came out last year. It's actually a highlighter. So I have been in tobacco control for over 20 years, as Duncan had mentioned, but I have a 14-year-old son. He knows what I do, but I still go through his backpack because you never know. He is susceptible to trying e-cigarettes. And is that highlighter really a highlighter, or could it be an actually e-cigarette device? Some other things that are now on the market. Sport watches have been on the market now for several different years. We all wear sport watches. A lot of people wear sport watches. Even our young people want to encourage them to stay physically active. But this is actually an e-cigarette. So it tells time, but it also tells when your battery's running low, when your e-liquid is running low. Wear it on the wrist and they can just put it up to their mouth and use it. You wouldn't know the difference. The picture in the middle, that is actually a hoodie that are available online. That drawstring is actually a tube that goes to inside the hoodie that hooks up to the e-cigarette device. So the student can be hands-free, or the adult, but they actually are marketed towards our young people. They can be hands-free. So if they're in the school, are they really chewing on their hoodie string, or are they actually using their e-cigarette? One of the most disturbing that came out within the past couple of years is the Puff It 2. It actually looks like an asthma inhaler, but it's a nicotine delivery system. And I want to make note that all the things that I'm showing you have been found in schools across the country recently that we have heard from our training participants. On the bottom left, there's lots of different lanyards and koozies that are being used so that youth can just put it right around their neck, stuck it in their shirt, and then pull it out, and it can be easily hidden because they can just pull it up and use it. The one in the middle on the bottom, that's actually a vape pen. They have evolved over several years to where it's actually a pen on one side, and then it's the vaping device on the other side. And then who doesn't have a cell phone these days, right? So now they have e-cigarettes that on the back, it can hold your e-cigarette for your phone cover, as well as charge your e-cigarette at the same time. So it's multi-purpose. Again, this is really teaching our students to be dishonest to what they actually have. Not only some of those, but this is some of the e-cigarettes that are produced by the e-cigarette companies, the tobacco industry companies. And I wish I could see your all faces, because I'm sure you're probably sitting there like I did when I first saw it and say, SpongeBob? Really? SpongeBob? Are we Mario? Are we taking SpongeBob and Mario? So this was just within the past year. And in August of 23, the FDA, the Food and Drug Administration, issued warning letters to 15 online retailers for selling and or distributing unauthorized e-cigarette products packaged to look like youth appealing characters, school supplies, toys, drinks. And these are just some of the examples where that was found by FDA, and they were sent out these letters. Now here are some little bit of homemade devices. So these are ones that were actually confiscated in schools over the past couple of years. And the first one on the left, we talk about physical activity a lot, staying healthy, right? And food, nutrition. And we want our students to stay healthy by staying hydrated. And a lot of our schools use water bottles and allow students to bring in the water bottles. Well, this water bottle on the left-hand side was confiscated at a school this past year. The young student attached their e-cigarette to the end of the straw. So it looked like they were drinking their water and staying hydrated and healthy all day, when in actuality, they're actually using their e-cigarette. And then the picture on the left, is that really a Sharpie? Well, take a closer look, because it's not just a Sharpie. It was at one point. The student took out the big marker Sharpie point and put in the Juul device. And you can see that they had a little hook that they were just hanging right onto their backpack. So really making it really deceiving to what the students are using. So why is this? Why are the rates that young people vape and why are they start? Why are they so high? What's going on here? So we know in the National Youth Tobacco Survey, the commonly most reported reason for students to try an e-cigarette, so that first use, that experimenting among high school students, but they were just because a friend used them, which was over 60%. And then in middle school, they were just curious about them. That's almost 50%. You can see that on the screen. But the most common reason for currently, so we tried it. Now, why am I continuing to still use it? Is high school, they wanted to get that high. They wanted to get that nicotine buzz. And then in middle school, they were feeling anxious or stressed. This is really particularly concerning given the bidirectional association between nicotine use and mental health disorders such as depression and anxiety. Studies have found youth with mental health disorders were at increased risk for cigarette smoking, but also that youth nicotine exposure was associated with the development of mental health disorders. So additionally, nicotine withdrawal is commonly accompanied by symptoms of anxiety and depression, and relief of these symptoms through use of nicotine-containing tobacco product or nicotine replacement therapy might perpetuate that continued nicotine use. So what can we do about it? Prevention is key. So currently, you can see on the screen that Catch My Breath is the only youth vaping prevention program that is evidence-based, improving both knowledge and then also behavior, which I'm going to talk about in just a minute. So SAMHSA, which stands for the Substance Abuse and Mental Health Services Administration, and is the agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of our nation. Catch My Breath is the only school-based intervention listed in SAMHSA's evidence-based resource guide series, Reducing Vaping Among Youth and Young Adults. So based on our paper from our peer-reviewed research, as I just mentioned, it was published in Public Health Reports. We want to give you an idea of what our program, if you implement the Catch My Breath program, what does that mean for your school? So the average 7th grade class size in U.S. public schools is approximately 192 students. If nothing is done, we project 17 of those 7th grade students will try an e-cigarette by the end of this school year. And if a school can implement Catch My Breath, 8 of those 17 students, about 45%, will not try an e-cigarette in this year. So if every public school across the country implemented Catch My Breath, we'd save about 154,000 students would not try an e-cigarette this year. And this is only in 7th grade. So we have the increase in knowledge, but also that behavior change where 45% of our kids will not even try the e-cigarette. So Catch My Breath is a nicotine vaping prevention program that has been proven effective at reducing the likelihood that students will experiment with vaping. The theoretical background for the program is social cognitive theory, which views health behaviors as products of personal, social, and environmental factors. So personally, what do I know about e-cigarettes and what can I do? What are my beliefs and attitudes about e-cigarettes? Socially, what is the social response to me using or not using e-cigarettes? And then my environment. How does my environment support and reward or discourage and punish the use or not use of e-cigarettes? So in addition to building knowledge, Catch My Breath disrupts normative beliefs such as the notion that everybody's doing it. Students develop skills to help them resist that peer pressure and see through advertising and misinformation that perpetuates both online and from their peers. And as the whole, the program creates favorable attitudes and beliefs about not using e-cigarettes. After all, the question isn't what will my students do if they're exposed to e-cigarettes, but what will my students do when they're exposed to e-cigarettes? And Catch My Breath gives students a wide range of skills and tools to help them respond to a number of those real-world scenarios. So who developed our program? Our program was designed by our lead researcher professor, Dr. Stephen Kelder from the University of Texas Health Science Center at Houston School of Public Health. Dr. Kelder, fun fact, he was a scientific editor on the Surgeon General's report that came out in 2016 on e-cigarettes. He was also one of the expert witnesses on the Juul settlement cases that have just happened. He has over 30 years of experience developing, researching different child health programs, and we continue at Catch. I work with him on a weekly, sometimes daily basis. So we know that alignment with academic standards can help you fit Catch My Breath into your schedules. So we've aligned the Catch program with national health education standards, Common Core, and then that social emotional learning through the CASEL competencies. Our program does meet your state health education standards, which also allows for implementation of our program to meet those requirements. Catch My Breath also incorporates social emotional learning, specifically those CASEL competencies, to the curriculum to really create a holistic learning experience for students and teachers alike. So youth, not only youth empowered, but youth developed. So really excited, as Duncan mentioned, that our Catch My Breath Youth Advisory Board really advises, and actually they created our high school curriculum for Catch My Breath. We asked them a couple years ago to take a look at it. What changes would you make? They're like, can we throw it out and just create a new one? Absolutely. So we have our students fully involved, not only with our Catch My Breath marketing, but also our Catch My Breath curriculum. It's really important to have something that's current and up to date and what students will actually recognize. So where are we? So Catch Global Foundation has been able to successfully bring the program nationwide and has worked with districts of all shapes and sizes in every state. As you can see, Catch My Breath is in every state across the country and reaches small rural communities like Idaho Falls and large metro districts like New York City Public Schools. 90% of our top 100 districts use Catch My Breath, with 185 of the top 250 districts using Catch My Breath. We currently have, how does this happen? One of it is our community trainers. So we currently have over 700 Catch My Breath community trainers across the country. This ensures sustainability of implementation within their communities that they serve. Who are our partners? We work with a variety of partners within communities for broader impact for Catch My Breath. These partners really help drive adoption, support implementation, and inform local policies. And of course, the school districts and individuals working with them are key members of the community and at the core of our Catch My Breath program. So it really makes it easy to implement and doable to do the whole child approach and support students' wellness. We have proven formula of knowledge building plus skill building and environmental support in order to develop healthy kids over a lifetime. These are three key factors and things that work together to create healthy learners, where we certainly try to build knowledge around health behaviors and decision making, but we really back that up with skill building and that practice and opportunities to really reinforce that information. These two things, coupled with the environmental support, really makes it possible to develop healthy learners who make healthy decisions day in and day out. Skill building and environmental support are why Catch My Breath is the only program, as I mentioned, that has the evidence base for behavior change. We do offer robust curriculum and resources. We have our core curriculum, our evidence-based curriculum. It goes through grades 5 through 12. Each lesson is 4 lessons, about 35 to 40 minutes each. We come with a scripted educator guide and a scripted PowerPoint presentation for ease of implementation. Every lesson, students are broken out into peer-led groups where we have that youth peer empowerment that I mentioned that really gives an opportunity for students to go ahead and use the curriculum within their own words and with their own environment and how it's really affecting them on a daily basis. Our current curriculum currently comes in English, and I am so super excited to announce that within just a week, next month, we'll have our Spanish version released of the Catch My Breath core curriculum. We also have another key component is our parent information. So we have our parent toolkits for grades K through 4, and then we also have another parent toolkit for 5 through 12. It consists of videos and presentations that are both come in English and Spanish. And then we also have a core group of supplements. So we have STEM humanities for both middle and high school. We have that PE adoption. So we know that a lot of students our teachers are both health educators that are also working in the gym. So we have students that are doing calisthenics, relay races, all learning about youth vaping prevention. We have virtual field trips, self-paced modules. We have an extra lesson on vaping cannabis, and then also our oral health curriculum, which is all available and free on our site. So our parents are important, as I mentioned. They're a very important asset when discussing risk behaviors, especially something like vaping. And their children, parents are often ill-informed and unsure of where to start on such a difficult topic like vaping. So we have a lot of resources for parents because they're creditable resources that parents can actually use and go to. So it's free for them to access on our site. We are a catch-all for some really great resources, including parent presentations, worksheets, toolkits, and videos. And then we also provide other FAQ information from some of our partners like FDA, Truth Initiative, Campaign for Tobacco-Free Kids, CDC, and many more. So as we continue, just a little bit
Marcel,
more.
just going to let you know, this is your just 5-minute time check.
That is perfect because I'm getting ready to wrap up just a couple more slides and I'm going to be passing it over to Ryan. Thanks, Brooks. So our dedicated community consultants are experts and have worked in the field of public health departments, passing legislation, graduates from universities, PhD research, and more. Our impact for our training support implementation of Catch My Breath in a community, along with the train the trainer model for certifying individuals to facilitate implementation training with educators for that fidelity, sustainability, and reaching more youth. Pending CEUs from accreditation for continuing education programs for tobacco treatment specialists is up and coming as well. We also take a holistic whole child approach with a suite of K through 12 health and wellness programs focused on prevention. So to get to the root causes of youth vaping, use Catch as a suite of different programs to strengthen overall mental health and resilience and develop skills for stress management and release, rebuilding up those healthy relationships and other substance avoidance while supporting overall health and wellness. So Catch supports physical activity, mental well-being, and substance avoidance to help young people live healthy lifestyles, which leads to positive attendance, many different achievements, and overall well-being of our youth. It's a self-reinforcing cycle that without one, there cannot be the other. And with that, if you have more information for Catch My Breath, go ahead, feel free and click that QR code, and we'd be more than happy to connect with one of you. And I'm going to pass it over to Ryan, and we're going to have time for some Q&A at the end. I will stop sharing my screen. There you go, Ryan, take it away.
All right, thank you, Marcella. An excellent job of creating the need for tobacco and vaping work, which really sets the foundation and addresses what it is that our schools, our communities, our parents are really facing when addressing the vaping, the tobacco use among our youth. My name is Ryan Monroe. I am a program manager with the Alliance for a Healthier Generation. I work with schools and districts nationwide to implement different tobacco and vaping prevention efforts and initiatives that help to really build a healthy school environment. That's really what we focus on. What I want to make sure to reiterate today is that this is an introductory to our work. We hope that you take the baton and can be able to implement some of the work that we do, some of our resources, but also be able to collaborate with us either at Healthier Generation or our partners over at Catch, because we're all just one piece of the puzzle to completing a more complete picture in addressing the vaping and tobacco epidemic that we face. Just want to really quickly give an overview of Alliance for a Healthier Generation. We emphasize whole child health and health equity. That's at the heart of what we do. We really want to aim to ensure that every mind, body, and young person is healthy and ready to succeed. When we focus on our school health, we can make sure that they have the tools and resources to thrive in the school environment. Looking at how we go about doing our work at Healthier Generation, we want to really focus on integrating health and learning, making sure that we're not separating these two categories out, but rather that we are able to combine those so that it is a streamlined and integrative approach and being able to create the healthiest school environment that we possibly can for when the kids are at school, they're able to be healthy and successful, both learning and from a health outcome standpoint. How we do that? We want to focus on policies, practices, systems, and environments. This is really important to the structural items in addressing some of the tobacco and vaping use that we see in the schools. This ultimately is going to lead to increasing our physical and social emotional health for our students and our youth. Now, when we get a little bit deeper into the work that we do at Healthier Generation in addressing tobacco and vaping use in schools, we really focus on 4 key pillars. Our first pillar is going to be our Thriving Schools Integrative Assessment. This assessment is an excellent starting point for schools and districts to be able to evaluate their current school environment, of what they're doing well. They can celebrate their successes, but it also is going to highlight opportunities for improving their environment as well. Based on best practices for school environment, it really is going to set the roadmap for future work for them to be able to work on. Our second key pillar that we focus on is going to be our district tobacco-free model policy. This was established several years ago in collaboration with the American Heart Association. This really lays out what a model policy should language, how it should mimic, but really importantly is how schools can begin to implement the policy. That's the most important part with policy work, is making sure that we are implementing it from a district level down to the school level to support our students during that time. In order for us to do that, we know our third pillar has to be professional learning and professional resources that we can provide to schools and districts, community organizations, different partners such as Catch, that we can be able to collaborate and provide the training that is necessary for school staff to be able to be successful in building that school environment. And lastly, as Marcel mentioned, the youth component is extremely important. We want to focus on establishing a culture. And in order to do that, we need to establish and provide youth with that avenue and opportunity to be part of that cultural change. We know that us as leaders can't necessarily create that culture change. We want to make sure that we have youth involvement and youth engagement with every step that we're focusing on. But also, secondly, we want to focus on community engagement. We understand that schools don't have all the resources. We at Healthier Generation don't have all the resources as well. We need to rely on collaboration, on connection with local communities to be able to support a comprehensive tobacco and vaping-free schools. One thing you'll notice that we don't mention in here is that these are one piece of the puzzle that we at Healthier Generation address. You'll notice we don't work into the curriculum or cessation period. This is where we focus and draw in local partners such as Catch that can help to kind of really completely paint that comprehensive approach. What we're going to focus on today is how we can, from a structural standpoint, work to continuously improve tobacco and vaping prevention in schools. We need to understand that we can't necessarily just completely shift the way that schools operate, and that it has to be a long-term process over several years about progressively building a healthy school environment within the schools. With that, we emphasize our 6-step process. Now, our 6-step process is going to be, although it shows cyclical, you can actually step in at any step of the way and any portion of the process, depending on what your history has been as a district or a school, but also where you have been and where you've been successful in previous terms. We're going to focus first and foremost as a key component that I emphasize as a really, really, really important part. It's building support. When we build support, we talk about developing committees, developing a comprehensive group of people that are at the table that can have these discussions, that can also allow us to be able to formulate our plans, that can draw in additional resources. But what's really important is from a sustainability process. I see too often in schools where the tobacco and vaping work gets shifted onto 1 or 2 individuals. They're responsible for addressing it from a district and a school standpoint. That person leaves, and all of a sudden, all the previous hard work they've done goes to the wayside, and we have to start over. That's a big reason why we want to make sure that we have a first initial start with a building support process. 5 components that we want to mention about the functions of a district team. We want to make sure that it reflects diversity. The diversity of our students, of our community, that's a critical first step. Secondly, is that we need to make sure that we can work to create buy-in. We can get support from our school staff members, our leadership at our schools and districts, our community organizations, parents, and community organizations and people of the like. Thirdly, is that we can advise and advocate. So we can be the change agent to be able to steer the ship in the direction that we want to go in being able to address tobacco and vaping. Our 4th function is important, is that we get to go into the fun part of taking action to actually improve the environment. And lastly, being able to support priorities at the school and districts, making sure that momentum continues on into the future. Just real quickly, just to highlight the key component here is that we have a comprehensive and we have a diverse group of people that are at the table for addressing tobacco and vaping use in our schools, especially with our policy making. We need to make sure that we have people such as our superintendent or our district level designees, caregivers or family members, students, teachers, school nurses, but also thinking about outside the box, thinking of local business owners, to the general public representation, community health professionals, and the like. So really, when you're developing your committee, make sure it is a diverse group of people that are at the table to help to steer the activities and resources that you're working through. Just want to highlight really quickly a resource that we have at Healthier Generation that you can take with you and be able to access. Our tools and resources are free to be able to access on our Action Center. It's not just healthier generation resources that are in there. There's also a variety of resources that are available to you from our key partners as well. So I want to make sure to keep that in mind from a collaboration standpoint, is that it's not just healthier generation information and resources that are in our Action Center. There's a variety of other organizations work as well, based on the content, the area that you want to focus on. So as we progress through our 6-step process, our second step is to really assess our policies and our practices. We want to evaluate where we are with our current school environment and where some shortfalls might be so that we can actively seek to improve that environment. As I mentioned previously, how we do that is to start out with our Thriving Schools Integrative Assessment. This actually does allow you for district and school access. It allows you, as you can see on the screen, to invite team members. You can download different guides that can support you through the way. This is evaluation against best practices for your school environment. What's really important with this is it provides the structure and the interwoven web to be able to allow you to take your assessment and automatically start to build out your action steps for what you want to work on to meeting those benchmarks for year over year. What's also nice with this is that it's going to provide you with the tools and the resources and links to different trainings that link directly with those specific questions. Now, not to overwhelm you, there are a lot of assessment topics. Why that is because, as I mentioned previously, we at Healthier Generation emphasize the whole child approach. We want to make sure that we are a comprehensive approach that are focusing on the various needs of students. But for today, we're going to focus on promoting tobacco-free schools and tobacco-free vaping as well. As you can see just on the screenshot here, there are 28 questions that go into our Promoting Tobacco-Free Schools section. Out of these 28 questions, you can start to formulate where you're doing very well, but also identify opportunities that maybe you don't have in place, but might be opportunities for you to address either this year or in the coming years that you might have in your journey to improving the school. Also want to lastly, just as we start to assess our school environment, we also want to assess our current policy. This is often one when I work with schools that a lot of our school staff members don't really know what's in our school policy from a tobacco vaping standpoint. It's time to dust that off. Let's take a look at it. Let's review it. Let's benchmark against what we have as a model policy for best practice and being able to kind of start formulating a draft for your new model policy. This policy has different components such as rationale, our model policy language, but really importantly, it has administrative rules and code of conduct language that can help to take that policy and instead of leaving it on the shelf and collecting dust, we can be able to start implementing that policy and being able to do so with a supportive disciplinary lens to provide support for our students. Going on to our third step, we look at as we're progressing, we've built our support, we've assessed our current environment. Now it's time to start developing that roadmap or our action plan for what we want to work on, not only this year, but in future years to go as well. Important to note 4 key things when we talk about choosing our action plan goals. We want to make sure that it's important, it's feasible, it has reach and strength, and lastly, that it is sustainable. Again, sustainability is such an important factor because all too often we see it be leveraged onto one person, or the fact that like we have a really gung-ho person right now that's able to do this in 1 year. We make a lot of sweeping changes and then we get busy, and then what happens? We go back to and we revert to our old ways. We want to take baby steps to be able to improve our school environment year after year after year and keep these goals in mind when we are doing that to develop our action plan. Just a really quick screenshot that we have here is our action plan that is in our Action Center. This is directly linked with our Thriving Schools Integrative Assessment. So as you can see here, there are specific questions or criteria area that you would have asked or addressed on the Thriving Schools Assessment. You can start to move these over to the action plan. When you move them over to the action plan, they are going to automatically be on the to work on section, as you can see on the screen. This is something that you as a district or a school can identify and say, hey, here's what we want to work on. We don't know when we're going to work on it, but we know this is a long-term focus for us. You can start to progress those questions into more immediate terms and being able to address tobacco and vaping when we focus on this year's goals. This is going to help with your committee, with your team, but also with different schools about what your priorities are for this current school year or for the current year that you're in addressing tobacco and vaping. But what's really important is that last category. We want to be able to celebrate all the work that we're doing to be able to show to leaders in our community, to our school district leadership, to our school board, that here's what we've all done and accomplished since we've started this journey in addressing tobacco and vaping. It's also really important for our triennial assessments that we can look back and say, here's what we've all done. This type of format with the action plan is going to be available no matter what category you are planning to address. Diving a little bit deeper into a specific question, as you can see here, and what the format looks like. Question on the left, as you can see, answer yes or no whether it's in place. Over on the right-hand side, you can see where it says add to action plan, but also just below that, you can see the hyperlinks that are going to link you with specific resources that are going to give you more information, more education, more resources to be able to start to change this and start to implement this change in your school. Going on here a little bit more, again, we talk about the format and the structure in the school and the district, and the action planning piece is that we want to continue to show progress year after year after year. We don't want to make all these sweeping changes and do it in just one note. We want to make sure and understand that school staff members, community organizations, parents, things like that, all have a lot going on. We want to make sure that we can add notes and tasks for our committee to be able to collaborate and work on, and be able to share progress at our next committee meeting, but also be able to share where we're at and being able to implement this in a structured and organized manner. Again, on the right side, you can see a variety of tools and resources that are available as you're in this question. Good opportunity there to be able to engage with that work. Getting down here to our fourth step, and when we get to exploring resources. So we've already assessed, we know where is a current gap. We've developed our plan, our roadmap for what we want to work on. Now it's important to make sure that we have the resources necessary to effectively implement our plan. This is going to be our fourth step in the process. One resource that I want to highlight from Healthier Generation that we have, and again, this is in our Action Center. This is going to be a resource mapping tool to support tobacco-free school districts. You can see it's a four-step approach. We've already established our team. Okay, that's our step one. What we're doing now is we are trying to provide a map of available resources that increases the chances and likelihood that students access what they need, but also schools have the resources to be effective in implementing their program and plan. This is a great resource for you to start to highlight and develop what's available in your local community, what's available from a national organization standpoint, but also how you can start to align those with your goals and action plan. Just a really quick screenshot, as you can see here, you can see up at the top, tobacco-free resource map. Up on the top right, there's actually a create your own map with this editable template that actually is going to link you to a template that you can use to start to fill this out. You can see the example of how it's all filled out. Also on the top left, that first bullet point, you can see Catch My Breath as a school-based prevention program. So again, excellent collaboration. It's not just Healthier Generation resources that are in here. We try to pull together as many resources as we can to support the schools, no matter what it is that they need. Just real quickly, and lastly here, you can access directly our tobacco and vaping prevention initiatives. If you go to healthiergeneration.org/tobacco, that's going to get you to the area that you want to go to get these resources. You can actually search, you can have different tags with it, whether it's going to be a training, it's going to be a document, a website. You can actually start to kind of filter that out when reviewing all of these different resources. So we're continuing here now. We've explored our resources. We have our map, our resources mapped out of what it is that's available to us. Now it becomes the fun part. We can start to take action to changing the school environment in a healthy and positive way, to making sure that we're reducing vaping and tobacco use, educating our youth, getting them along board of being able to change the culture that we see in schools to be anti-vaping and anti-tobacco use. So when we look at implementation strategies, just real quick, when we look at 4 key pillars, especially when we look at the model policy, we want to review the model policy, identify what language needs to be revised. If there's any language that needs to be revised, again, the important part is being able to look at your policy, what's all in it, are we implementing? If we're not, why not? But then identifying gaps in what we consider as our model policy. You can then begin to start to draft your policy. We actually have a tool in our Action Center that's called the Tobacco Model Policy Builder, that you can take specific language from our model policy and start to formulate your own district policy. You can download it into Microsoft Word. You can download it and be able to edit it offline to be able to then ultimately take it to your school board, being able to get it approved. And lastly, most importantly, we want to make sure that we have different forms of communication to not only inform the schools, but also to be able to make sure that the community is aware of this new policy and the new change, but also being able to make sure that we are implementing our strategy. So one resource that we have to ensure that schools and districts are successful in implementing their new revised model policy is our tobacco-free district policy implementation checklist. This resource is really important to being able to, once we've done the policy work, we've got it all finalized and formalized, it's been approved, we now need to have actionable steps that we can take to put it fully in place and making sure that what's happening at the district level is getting filtered down to the school level and ultimately is supporting and benefiting our students when and where they may need it. You can see with our implementation checklist, there are 8 key areas. It kind of progresses into each one of those. So it's kind of a progression standpoint. As we talked about with our 6-step process, this is going to have 8 steps for implementation that you'll see here with our process here. And just a quick checklist, as you can see with our leadership team, you can see the actionable steps, you can see the resources, what model policy language it's associated with. You can actually start to be able to check off some of these action items when you go to implement your policy. So again, this resource is in our Action Center, good resource for you. When this webinar is done and this presentation is up on the Catch site, you'll be able to access this and be able to see through this again. Last resource just to highlight is a referral pathway. As I mentioned, we want to emphasize a supportive disciplinary lens. We want to make sure that if a student is caught with a tobacco or vaping device in the schools, that we're getting them the support that they may need to kick the habit, that we are referring them to the appropriate pathways to be able to make sure that they can quit the habit that they have and be able to stay in the school, connecting learning and health at the same time, and being able to define that pathway of how the schools and districts go about doing that. Just a quick snippet of our 3 steps. You can identify your supports and your team. You have your referral flow, referral follow-up. So again, these 3 steps are what's going to be really critically important as you begin to evaluate your referral pathway based on a supportive disciplinary lens. You want to make sure that you have these steps in line. And this resource is going to be excellent for you to kind of start filling out and mapping out what your referral pathway looks like. So we've made it all the way through our first 5 steps. Now it's the fun part. We've taken action. We've had some success. We've shown some improvements. Now it's what we need to do, and we need to celebrate success. Our schools and our districts are doing a lot of really excellent things. We need to celebrate them more. At Healthier Generation, we have our America's Healthiest Schools Award. This is an award that honors schools for the key role that they play in advancing health and well-being. The award criteria is all going to be based on what we saw in our Thriving Schools Integrative Assessment, those different categories. So you might say, you know what, we're working on tobacco and vaping. We're not quite there, but we want to get momentum as a district. But maybe you can apply in a physical education or physical activity section to get awarded and know down the road that you want to apply for tobacco and vaping as you start to progress and build your healthy school environment that way. Key thing to keep in mind, you can go to healthiergeneration.org/award to be able to access this. Otherwise, you can apply by April 16th. Word of note, don't wait until April 16th to apply. Who knows with technology, questions, things like that. Start early, contact us. We're here to help you and support you in this. We want to be able to honor you in the work that you're doing within your school and district. So looking at next steps as I wrap up, again, identify, we want you to take the baton. We've presented a lot of information here. It's time for us to pass the baton on to you all and begin to implement this information, these resources within your local community. You want to complete the Thriving Schools Integrative Assessment, the Tobacco-Free Schools module in particular. Review our model policy, but then identify possible revisions to the current policy. And always keep in mind that if you have questions, you can always connect with me as the program manager that works with schools and districts around tobacco and vaping. My role, what I do is I basically help guide schools and districts around that 6-step process, working with leadership teams, assessing data, creating key priorities, but also making sure that we're mapping out the resources and implementing it appropriately. So I'm going to stop right there, and I just want to say thank you so much for tuning in. I hope you learned a lot, but again, take the baton, reach out to either myself or Marcella for follow-up, but I am going to pass it over to Marcella to kind of wrap us up.
Great. Thank you so much, Ryan. Really appreciate it. Just amazing how we got prevention and then policy and how we can collaborate and work together. Because as you mentioned, it takes multiple facets, not just one. Brooks, I'm going to turn it over to you. So here's our contact information, but I believe we have some questions.
Perfect, perfect. Thank you so much. Yeah, I just want to remind folks, you can type questions into that Q&A tool down in your toolbar. We, obviously won't be able to get to everyone's question today, but those do get saved, and we will get like a log of those questions, and we can try to follow up with some folks in certain cases. But make sure you don't submit it anonymously if you're hoping we will follow up with you. Obviously, we can't if you submit anonymously, but I'm trying to synthesize a few themes here to kind of get general questions. And one thing I'm seeing several, heartbreaking but unfortunately common, comments about schools feeling somewhat helpless here. Schools, teachers, districts, some parents. I'm going to start with you, Marcella, and then want to ask you, Ryan. Like, what do you say to these people who feel that this issue is too big and pervasive to actually be able to impact?
They're not alone. And that's the big thing. It's happening in rural counties. It's happening in major markets as well. It's happening in every school across the country. And there's free resources out there for help. And that's the big thing, is that there's places you can go to. There's prevention, there's cessation, there's intervention, there's policies that can be implemented. We're here to help. I know, as Ryan is, if there's a specific situation within your community, reach out to us. That's one of the reasons why Ryan and I wanted to host this, is that there's resources here to help, and we're here to help you.
Yeah, and I would just add on to what Marcella says. Yeah, it's certainly heartbreaking to see where we're at right now, but that doesn't mean just because of what's happening in the past doesn't mean we can't create a better future. What we talked about is collaboration is extremely important. We know, as a pulse check on our schools and our districts, they are very overwhelmed. They've got a lot going on. We need to start to address this program from not only a community standpoint, working with parents to educate parents and caregivers, working with as a collaborative and comprehensive approach, knowing that together we can make a more complete and better picture for our future.
Great. Well, one thing that people did latch onto that I think is, kind of a key to breaking through and having success is getting youth to engage in these efforts. So, Ryan, I'll start with you this time and then go to Marcella. Can you talk a little bit about, the importance of getting youth involved, suggestions or things around, what Alliance recommends to get youth involved in some of this policy stuff? And then Marcella, you can follow on.
Yeah, this is a critical step. That's why we have it as one of our 4 key pillars, is that we know that as adults, it's hard for us to shape the culture of our youth. We would like to say that they listen to us all the time, but in reality is we want our students to be able to kind of help steer the shift as well. We want to make sure that they're involved in our committees. They have a voice at the table for how they're shaping it, but also know that they're important to the future of the success of addressing tobacco and vaping. That's ultimately going to help to kind of set that culture at the school and being able to do that. So it's really important to engaging, as Marcella said, with some of the older students in particular, but really starting to engage youth at a younger age to be involved in addressing this. So I'll pass it over to Marcella. She's got a really great resource when it comes to youth involvement.
Thanks, Ryan. And just to echo what Ryan said, is have youth involved into that policy piece, because this is what's affecting their everyday lives. So besides us having our youth with our Catch My Breath Youth Advisory Board, which represents national students from across the country, they are, they look at our curriculum, and it is youth empowered, youth informed, youth created curriculum. So what actually works for them. And then we've taken it one step further with some partners that we worked with in Idaho, and our Catch My Breath Youth Advisory Board members. We know the importance of students, and it's that students teach students model. This group of students really want to help educate others, help share their knowledge. They care. Depending on all the stuff you hear in the news, they truly care about each other, and they want their friends and their peers to have a safe place to go and really be empowered to help them live healthier lives. And they've seen personally, we heard stories, they've seen personally their friends, their family members that have gone to tobacco use and using e-cigarettes, and then they're not friends anymore, or they're getting off the football team, or they're just leading down a different lifestyle because of the addiction. So we look forward to rolling out over the summer our Students Teach Students model, really engaging the high school students to go in and talk to those middle school students, because like you said, Ryan and Brooks, they're going to listen to their older peers before they're going to listen to us.
Right. So the other piece of that, and multiple people tapped into this as well, was getting parents informed as well as involved. Just because parents, didn't have any experience growing up with these kinds of devices, it's totally different. One thing that I say sometimes is, you can have an 11-year-old with a 2-pack a day habit. Can you imagine trying to hide a 2-pack a day habit, with cigarettes? It sounds impossible, but with vaping, it's unfortunately like, not at all hard to hide. So what do you do to crack through and get through to parents to get them to pay attention to this issue, they might be in denial a little bit about it, and what can they do to kind of help efforts in the school setting? So Marcella, you want to start, and then we'll go to Ryan.
Sure. So you hit it spot on, Brooks. We heard from our community members, and we would, Dr. Calder know that parents are key. And unfortunately, as I'm older, I wasn't the generation to do the e-cigarettes, but the younger group of parents are. You've got mid-20s, parents, they grew up with e-cigarettes. So really educating not only our parents of grades 5 through 12 and how do I address that, and what do I do, what if I use tobacco, how do I not be a hypocrite. We did several different focus groups with parents to what questions would they need to answer, how can you help your child without being accusatory or being bad cop. So we have those free resources on our website. Also, we went to, when we saw that younger population, hearing kindergartners that are coming in with e-cigarettes, I went to our team and Dr. Keller, I'm like, we need something for this younger age group. And he talked to different professors. We really need to educate the parents. The parents of those young people need to know not to leave the e-cigarette laying around, not to, that it is dangerous and that it's not as healthy. We have also incorporated that. A third step, then I'll turn it over to Ryan, is that we actually incorporated that in our train the trainer model. We have a parent community presentation. We understand also that grandparents are sometimes the parent now, and they're bringing up, so that generation really does not understand what e-cigarettes are. So we have that presentation. We train our trainers to know how to host those parent nights and how can they educate. So again, that broader depth of being able to help educate parents on the dangers of e-cigarettes. Ryan, to you.
Yeah, great points, Marcel. And I would just say that having an emphasis on parents is really important from a prevention standpoint. As we noted previously, schools have a lot going on. Our school staff are overloaded. They've got a lot going on. We are trying to start to focus and catch, I know in our conversations, we need to really educate the parents and being able to make sure that they're aware of the impact when they leave their vaping device around, and their young child is able to see that, and they're seeing them using it, and they're seeing them do it, and they leave it around. They end up taking that to school, and now the school is addressing that with the student at a young age. We're seeing it at a very young age, as Marcella mentioned. So we need to really focus on and working with the parents and guardians and community to help to reduce and have an awareness campaign so that we're stopping the number of aspects that are happening within the school, knowing that the schools have a lot of things going on right now. That's a critical first part that we're starting to shift to, is really focus on parents and community.
Ryan, specific question for you here. Some folks have asked about who can use the assessment tool, and specifically some community health organizations or health workers. Are they able to also, kind of use the tool? Someone specifically in Illinois works with 16, schools in 16 counties. So what do you recommend for those kinds of organizations working with schools?
Yeah, certainly. So you can definitely use that tool. That's an opportunity for you. You can actually, what you'll want to do is link up with your district contact or your school contact that you're working with, and have them and you kind of co-join that and co-partner with that, and starting to choose what it is that we're working on, things like that. So it is a free tool for you to utilize as community health organizations, but also for the school as well. Just make sure, the thing that we want to do is make sure that the school has involvement with it, because that's a key component, that they will have shared access with what's going on at the school.
Right. Marcella, one question about the Catch program, and people asking about kind of speaking to kids at their level, and grade differentiation, I think is kind of the theme here. But someone was asking, is the program content presented to students at their grade level? Specifically, this person was asking about middle school, and kind of getting them to understand health consequences as a middle school would care about them, not, it's going to affect you when you're in your 60s. Can you talk a little bit about how you do that?
Yeah, sure. No, and that's a great question. So our core curriculum is for fifth. We have different lessons broken out by age group. So they do definitely address that different population. So we have a fifth grade lesson, sixth grade, seventh, eighth, and then high school. So it really does vary, the marketing, the terminology, the different things that they're seeing. So for example, in our younger grades, when we talk about media and marketing and how they're being marketed to about these products, one of the activities that we have is students create a poster so that they can create awareness with their student population and their peers about the dangers of e-cigarettes. Then you go into seventh and eighth grade, they're not creating a poster, they're creating a social media post, because that's what they're all about. I know my eighth graders on the phone a lot, so they're creating that social media post, and so it does vary by age group.
Yeah. Well, on that note of what Catch offers, Carrie Ann H asked, what does Catch My Breath offer that others don't?
Sure. So, and that's another great question, because there's different programs out there like Stanford Tobacco Toolkit, and then also the Truth Initiative with their and EverFi with their program. So Catch My Breath varies in a couple different ways. It is adult facilitated, or now with our students teach students model. It is in the classroom. It's designed. It could be classroom or other after school clubs as well. So any organization that works with young people. We have that peer-to-peer facilitation. The other thing that differentiates is that it's not just a click through. So there's some programs that are just the student logs in and they just go through a 10-minute module. We're not a 10-minute module. We engage with the students. They're doing their activities. There's hands-on activities for them to work with. And then that other big difference is that we're age appropriate. So it's breaking out between which age group are those students in. And those are some of the big differentiations between us and some of the other programs.
If you don't mind my piling on just for a sec, I think another really great point about Catch, and many of you in the audience already know this, is our train the trainer model, and the way in which we're helping work with communities to empower you to then go and create your own community trainers and be able to bring it straight to schools in your own way, so that we now have, what is it, Marcella, 750 community trainers?
Over 700. Yeah. Yep, across the country, which actually empowers and provides that professional development training within the schools. So good point.
Yeah. And that actually is a good segue to a couple questions that multiple people have asked about. And Ryan, I'll start with you. What of these things are free that people can access? What are costs, and what are additional services and assistance that the two organizations can provide when it comes to using these resources? So Ryan, can you start?
Yeah, certainly. And good question. Cost is always a barrier for many schools and community organizations. Our tools and our resources on our action center that we referred to, all of those are going to be free to access. The only charge, the support that you get from me based on capacity, the only charge that would come with that is that if you wanted me to come on site for a professional learning opportunity, things like that, if there's travel costs associated with that, there might be some costs there. But aside from that, we are a remote organization that can provide technical assistance from our remote organization and our remote workplace. So again, we try to remove the barrier as much as we possibly can to supporting our schools and districts.
Yeah, fantastic. Along the same lines, Ryan, our Catch program is completely free. All the resources that I mentioned today through the STEM, the supplemental materials, the parent resources, that is all free access to you. Even the English and Spanish materials would be free of access to you. What is charged is the train the trainer model that Duncan had mentioned, that we do have a fee for service for that. And then if there's an implementation training. But other than that, our curriculum is completely free for you all to use as well.
Great. So we've got time for one more question. And I saw someone, kind of astutely point out that environment can, really play an important role here. And that there are ways for us to influence the environment and not just kind of be passive participants within it. So can you each speak a little bit about how the environment plays a role in all of this, and what we can, what's one thing maybe you would suggest folks could do to influence the environment to positively, affect this? So Ryan, you want to go first?
Yeah, I think the big thing to keep in mind, and environment is a huge component. Our society is a huge component as well. As Marcella mentioned, there's a lot of students that are doing a lot of really good things. We might get bogged down by what's happening in the media about a student or a small group of students. It's important to keep in mind and to understand that negativity screams and positivity whispers. What I mean by that is that there might be a whole section of students that are doing a lot of really great things in their school that we look over because the negativity screams part. Okay, so we want to make sure that we keep everything in context and knowing that there are good students out there. There's a lot of good students out there, a lot of great educators, teachers, community organizations. And it's all about important to sharing those positive things. That's why we talk about our award and our celebrating our successes, because there's a lot of good that's going on out there. And we need to level the playing field when it comes to celebrating those.
Yeah, that was perfect, Brian. Supporting the environment. There are kids that are doing such great things. And I think that's one of the things with our students teach student model that's going to be happening is the positive influence that they actually have on each other, and really changing the norms where some kids, we're hearing, unfortunately, that some kids are saying that they go to vaping because that's the only group that they can fit into. And our students are like, no, we want you to be part of our friend. So really empowering students to say, it's okay. This generation's not blaming them for vaping. They're not dissing on them. They want to help them. And I think that's another positive is the students that can positively help influence each other, that it's not a bad thing. We know you're addicted to something and we want to help you quit.
Right. Well, we're at the top of the hour again, so I want to respect folks' time. I'm going to ask one final question. It's very short, and it's too fun to not ask. But what is your best argument to convince teens that vaping is not cool? So, I will say that it's a pitfall to ask adults this question, but I still love hearing answers on it. But Marcella, what's your favorite, best argument that you think you've heard teens then kind of repeat, or maybe it came from teens in the first place?
Oh my, you're putting me on the spot. I'm not sure.
I am.
You are
Hot
putting
seat.
me on the spot.
I can
Brian, you got something?
I can attempt to take a perspective at it. I think really being able to show them the real life scenarios and examples of how detrimental it can be and what the impact is of doing it. I think there's such a disconnect between the education piece and them really understanding the negative detrimental effects, both from a variety of standpoints. So I think that's where I would kind of take it from, is really starting with the end in mind and showing them what negative effects that it can have.
So to build off of that, I think it would be no matter the device, it's the nicotine and how quickly the addiction can happen, because we even have a video like they don't realize that they're actually addicted to the product. So let them know that, educate them and have their peers educate them that they're actually addicted to the product. I'm not sure if that's where you were going, Brooks. I thought maybe you wanted something else a little bit different, but
No, wasn't fishing for anything, but again, just kind of, I think y'all both nailed it. That it really needs to kind of come from their context, and we can present health issues and things, but the stuff that resonates is usually the things that come from teens themselves, kind of telling us. So anyway, I want to thank everyone for participating today. This is a great webinar. I wish we had more time. We did record this. Just as a reminder to everyone, we'll send out the link to the webinar archive along with a PDF of the slides. Please do visit our websites, check out the resources, reach out to us with the contact info here. We'd love to continue the conversation on a one-on-one level. So we hope you'll take us up on that. But with that, I'll just say thank you again. Have a great rest of your day, rest of your week, and take care. Bye-bye.
thank you.